Doctors of Reddit, what is the most obvious lie a patient has ever told about their health history? Patient brought to the ER was allegedly naked in his bedroom making a salad when he accidentally sat on an upright cucumber. Really? Right in front of my salad? I've had multiple women claim to not have had sex in years while holding their positive pregnancy tests in my hand. I've had this happen so many times. There was a 3-month pregnant lady who claimed it's impossible for her to get pregnant because her husband has been out of the country for the past 7 months. No one ever tells the true story when something is stuck up their butt. I crammed it up there, you've gotta believe me. My fucking sides. We got a lot of mandible fractures in the OR, and it was always the same basic story of what happened. I was minding my own business and some guy sucker punched me at the bar. I fell off my bed and hit my nightstand. You could tell these people very clearly were in a brawl of some sort. I have a very hard time believing all of them were walking their grandmother to church and a random person punched them. I once gave myself a bruised orbital bone trying to pull my blankets up, so I'll believe a lot. My toddler gave me a fucking greater black eye. He was sitting on my lap and just slammed his head into my face. No one believed me that my 1-year-old gave me a black eye. It was better than any of the black eyes I got from hockey. Anyone who's met a toddler should have immediately believed this. Toddlers are chaos machines with rock hard heads. My diabetic patients, I take my insulin. I eat well. My finger sticks are in the 120 to 150 range, while their A1C is 13. My fucking grandma. Stop lying to the damn doctors and ignoring their instructions, grandma. Take your fucking meds and your treatments before I lose my shit. Cause I love her and want her around for as long as possible. Damn. The doctors that are dentists are probably thinking I floss every day. Hygienist during my last visit. So, you know how like, when you're flossing, me, nodding my head knowing full fucking well I don't floss. Haha. Dentist, why must you turn my office into a house of lies? When I worked in a gyn office, a patient had a really nasty vaginal infection and we could see obvious claw marks in her canal. Her story, she had gotten out of the shower, laid on the back on the bed with her legs up, and lifted her cat up above her. She then said she dropped the cat and the paw went into her vagina. What? I have so many questions I don't think I actually want the answers to. Too bad. I gave a plausible answer. Possible? My old Swiss doctor used to ask the question, how many drinks per day, and then double it. None. Double that. I used to work in X-ray. Sometimes people don't know they're lying. Backquote, have you had any metal replacement? Backquote, no, they just fixed the bone. Do the X-ray and it's a massive rod in there, and the patient literally had no idea that was there. Or the sadder cases of elderly people who just don't know. You tell them they've had a hip replacement, and they just don't believe you. Last week in an endocrine clinic, discussing an obese diabetic patient's weight gain and diet, I went through each of her meals asking when and what she eats. Essentially, she told me that she drinks a glass of water around noon each day and that's it. Still gaining weight. My attending, I'm a resident, told me I should have recommended that she drink half a glass of water instead. In all seriousness though, some people can't even be honest with themselves. So it's not worth getting upset if they are dishonest with you. Just keep encouraging them in the right direction. Freeze the water so it has less calories. Yes, I'm sexually active. Are you sexually active? God, I wish. Are you sexually active? No, I just lie there. Nurse practitioner, UDS, plus, for cocaine, opiates, whatever. I have not done any of those. How dare you ask me? Well, they were in your urine. So how did that happen? That motherfucking nurse planted them on me, or someone must have been snorting cocaine, and it came in through the windows and I inhaled it. Both completely true stories. Unreal. Nah man, you're guitar-booking cocaine and shooting up. We all see your track marks. What is guitar-booking? Rails/lines that resemble the plates on a gator's back, I'd assume. Nurse practitioner here. I used to work in an urgent care. Young lad late 20s comes in with hell of an infection on his left index finger that migrated to his entire hand. Considering severity of the infection, have to send him to for fourth antibiotics and questionable sepsis. During the visit, read some previous charts, and see this strapping lad also has history of IV drug use. Of course I questioned him if he injected recently, in which he vehemently denied, stating he's been clean for X weeks. Sure, I believe you. Later, go into his chart for a follow-up. He was in full sepsis and told the ear doc that he had injected drugs in his fingers. I repeat, he injected in his fingers just 4 days prior to infection starting. P.S. He also had full-blown dry gangrene in his right hand and needed several fingers amputated. BC of injecting eye drugs in those fingers. Sigh. I worked in a hospital for quite a while, though not as doctor. Normally it isn't lying about stuff deliberately. They are often convinced of what they are saying. For instance, a guy explained to me that it was normal for him to have very high blood pressure because he had it all the time. This is not normal. Going down for a smoke then coming up with a Pepsi and eating shit is not normal. The doc even told him, "You're not going to grow old like that." He ate poo. Anesthesiologist here. Patient lies about using drugs while needing twice the anesthetic of a normal person. It's sad to see. I'm a ginger, and apparently certain drugs tend to not work on us. A double dose of morphine made zero impact on my bout of pancreatitis, but Dilaudid certainly did. Now how to explain to medical professionals why I need the stronger stuff without sounding like a druggie. Not a doctor, but I've had a few doctors raise eyebrows, and when I was a university student lying about how much I drank a week. Also, I imagine the any consumption of recreational drugs question got a lot of false negatives. What's the point of lying about it? Not a doctor, but when my mill lies through her teeth to explain her blood sugar being so high and lying about what she eats. She's a nurse practitioner BTW. Not a doctor, but my cokehead uncle has suffered from sinus infections for years as a result of his use. He lies about the cause of his infections, saying it's allergies, a cold, or the flu to garner pity from others. He's on disability and Medicaid, so he can easily get in to see a doctor each time he gets sick. He's been on so many antibiotics he can only use the super strong stuff to combat the infections now. He takes pseudoephedrine every day to clear his nose as a result of his allergies. He uses so much pseudoephedrine he has to ask friends to buy it for him because he uses more than his state's monthly limit. He had surgery to open up his nasal passages a few years ago. He felt great for a few months before he went back to having the same issues. Jesus Christ, as someone with chronic sinusitis, I don't understand how he wouldn't do everything possible to not have sinus infections. They're the absolute worst. Not a doctor, but I work in a lab that does drug testing. Most common drugs we see are THC, amphetamine or cocaine. We also know above which value it becomes really unlikely that you consumed passively or just had contact with said drug. People mostly go for the good old I never did THC/amphetamine/cocaine, but their concentration is literally off the charts, which means active use. Excuses range from switched samples, nope, someone watched you pee into a cup, took the sample, and then labeled the tube in your presence. Botched analysis, unlikely. We use mass spectrometry for these kinds of things. Spiked drinks, possible. But you can't prove that, and it's your responsibility to stay clean to having consumed passively. Again, unlikely because of the value. If people are really convinced that they didn't do that specific drug, I ask if they took something that potentially wouldn't show up in our test panel. In about 80% of cases they get really quiet for a couple of seconds and then just stop arguing. People just assume that the shit they buy on the street is homogeneous and not laced with God knows what else. Your LSD, which we usually don't bother testing for because of low prevalence, might not be pure LSD. The weirdest ones are usually, I had sex with this girl/guy and she used. It must be from that, which is just ridiculous. And it's never kissing, or took something while I was there. It's always straight up fucking, like your penis or your vagina is an express highway for drugs. The funniest one was a guy who claimed he tested positive for cocaine because the prostitute he was with took cocaine and he just drank her pee, but did not use himself. We had fun with that one and calculated the amount of pee he had to ingest. Turns out it would take a couple of dozens of prostitutes and a literal fuck ton of cocaine, given the normal amount of urine a person passes in a day, which would have resulted in about 100 liters of pee he'd have to drink. I like how he was less embarrassed to say he hooked up with a prostitute and drank her pee than to just admit that he did cocaine. Wild. I was admitted for pancreatitis once, and the doctors and nurses repeatedly asked if I used drugs or was a heavy drinker. No to both. They continually didn't believe me, even though I told them to test me. I was in the hospital for over a week without once having any withdrawal symptoms. I know that patients lie, but it's just as frustrating when you're telling the truth and they don't believe you. Even my wife told them several times that I did not drink or use drugs, but they kept saying it's extremely rare to get pancreatitis if you're not a heavy user. I have not done any drugs recently. Tachycardic, pale, steamy on ECG, heart attack, and cocaine positive urine. Fun fact, we don't care or judge, but it does affect our treatment plans. So shoot straight people, and obviously stop making it snow in August and other illicit drugs. Standard not a drive, but, back in my drinking/alcoholic days, I was trying to convince multiple hospital staff, post blood work, that I hadn't had any alcohol. My back was 0.50 and I shouldn't have even been breathing. I once had an alcoholic patient with a back of 0.72. It was so high that I had to manually calculate it using the measured osmol in the blood because our machines only go up to 0.5. He was happily goose-stepping around the earth. How was he even standing up, let alone stepping around the earth? He was so far gone down the alcoholism path that a 0.0 back would have killed him. I put the carrot in there to try to stop my hemorrhoids bleeding, but it went in too far and now it's stuck. Not a doc, but I read medical records for work. One woman went to the ER for a cold sore on her mouth, which they determined was due to herpes. She then insisted that she got it from the chicken nuggets that she just ate prior to coming to the ER. This is totally the wrong place to ask this, but last year I got some pretty bad rhabdo from doing the same workout I had been doing for 6 months. Took me 2 days to go in, cause I just figured it was a pulled muscle that was making it miserable to walk with no signs of kidney failure. All doctors since give me a look of pure disbelief when I tell them I did nothing different. I can clearly see them checking the liar box in their head. How do you convince a doctor you aren't lying when your story makes no sense?